How is testicular cancer recurrence risk determined by stage? Imagine you're trying to understand how likely testicular cancer might come back after treatment. The key factor is the stage of the cancer at diagnosis, which tells us how far it has spread. Doctors use a system called the TNM system, which looks at the tumor size, whether lymph nodes are involved, and if the cancer has spread to other parts of the body. Based on this, they assign a stage from 1 to 3. In stage 1, the cancer is still confined to the testicle itself. But even within this stage, the risk of the cancer returning can vary. For seminoma, a common type of testicular cancer, about 16 to 20% of patients might see the cancer come back. Factors that increase this risk include larger tumors, invasion into the rete testis, which is a network of tubules inside the testicle, and cancer cells invading blood or lymphatic vessels. Also, if blood tests show elevated tumor markers like beta-human chorionic gonadotropin or lactate dehydrogenase before surgery, the chance of relapse is higher. Patients with none of these risk factors have a very low chance of recurrence, around 6%, while those with all risk factors could see more than a 60% chance of relapse. For non-seminomatous germ cell tumors in stage 1, the presence of lymphovascular invasion, meaning cancer cells have entered lymph or blood vessels, is a strong sign that the cancer might have spread microscopically beyond the testicle, increasing the chance of recurrence. Moving to stage 2, the cancer has spread to the lymph nodes in the retroperitoneal area, which is behind the abdomen. The risk here depends on how many lymph nodes are affected and their size. If fewer than 5 lymph nodes are involved and they are smaller than 2 centimeters, the outlook is better. But if the nodes are larger than 5 centimeters, the risk of the cancer coming back is higher, and the prognosis is less favorable. In stage 3, the cancer has spread beyond the lymph nodes to other parts of the body like the lungs, liver, bones, or brain. It also involves higher levels of tumor markers in the blood. The extent of metastasis and the levels of markers like alpha-fetoprotein, beta-human chorionic gonadotropin, and lactate dehydrogenase help determine recurrence risk. Patients with limited metastases and mildly elevated markers tend to have a better outlook, while those with widespread disease and very high markers face a higher chance of recurrence. Overall, the risk of testicular cancer returning depends on how far the cancer has spread and specific features seen under the microscope. These factors help doctors decide on the best treatment and follow-up plan to catch any recurrence early. Remember, everyone's situation is unique, so it's always best to discuss your individual risk with your healthcare provider. They can give you guidance tailored to your specific case and help you understand your prognosis based on your stage and pathology results.